City are the lowest they have been since the first wave. Joining us right now for a temperature check, Raywat Deonandan, Professor of Epidemiology and Science Communicator at the University of Ottawa. Welcome back.
Thank you for having me back.
Good to chat with you. So how do you think we're doing right now in the nation's capital?
We're doing pretty well. The reproduction number is 0.88, which is the lowest it's been in a while. Test positivity rate is 0.5%. Hospital beds aren't full, even though our acute beds are, pretty close to full. In general, we're doing okay, but that was expected given where we are in the pandemic and given the hotness of the summer days.
We have the lowest case numbers since September as well, in addition to all of those different metrics you just rattled off there. We know the vaccines have weakened the link between hospitalizations and the virus. Weakened, I want to stress, not eliminated. So how much does a case count number really matter anymore?
Yeah, that's a good question. It doesn't matter as much. It depends on what you care about. If you care about preserving the healthcare system, I think we've won that battle. I don't think that pillar of society is going to fall anytime soon. If you care about preventing deaths, I think we're going to do a good job of preventing a lot of unnecessary deaths. If you care about preventing suffering and long COVID, well, that's another story entirely. So we don't really know what the long-term consequences of infection are, and it seems to me that it's probably a good idea to avoid infection if you can. So that's why we should care about these numbers and the extent to which these numbers might be lagging indicators for something else coming. I don't think that's going to be the case. I think vaccination will cover our rear ends in that respect. But definitely it tells us that we may expect in a few years' time the results of infection that we do not know about now.
I'd also really like to know the correlation or the protection that Pfizer or Moderna or a vaccine actually prevent potentially against long COVID, right? Because we don't really have that answer. How much does your Pfizer or Moderna shot potentially protect you from getting long haul COVID?
That's right. We don't know that, except that we do know that it protects you at least a little bit against becoming infected at all. It prevents asymptomatic transmission to some extent. With AstraZeneca, one of the original estimates was like 67%. With the mRNA shots, some people have estimated 80%. It's probably not that high. So we know it offers better protection than nothing. What's definitely true is the vaccine itself will not give you COVID or long COVID. That I think is pretty reliable.
Okay, so I want to talk about what's happening with the kids, because 12 to 17-year-olds can now book in for an accelerated vaccine. Yay, 1-dose summer, 2-dose summer for other people, but 0-dose summer for the kids that are under 12.
Yeah.
They don't even get one shot. What are your thoughts on that demographic and the fact that those children are still unvaccinated?
So a lot of things to unpack there. First is when the fall comes, most of the population, if all goes well, will have had some immunity, but the single largest block with no immunity will be kids under 12, and they'll be concentrated in one place, that is schools. So we can expect when outbreaks happen, they'll be disproportionately present in schools. That means we have to focus our public health attentions on schools with masks and ventilation and small class sizes, et cetera, et cetera, et cetera. Will kids under 12 get vaccinated? We'll get some good data from the trials happening now by sometime in the fall, and likely, I suspect, it'll be okayed for that demographic by the end of the year. But do we need to vaccinate them? That's a larger, more complicated question. If you look at the risks posed by the vaccine itself, it's vanishingly small. Not zero, but vanishingly small. If you look at the risk posed by COVID, also quite small. So maybe those two are equal. In which case, the criterion for deciding if kids should get vaccinated or not really is the extent to which they contribute to herd immunity. And they do contribute. So it's an odd ethical scenario to ask kids to accept a vaccine in large part because you'll be providing herd immunity for the general population. It's a new thing to do. So and some parents, of course, want their kids to be protected, because if they're not protected, that may affect things like travel. As vaccine passports become the norm, if kids aren't vaccinated, can they cross the border freely? That's unknown. A lot of things to unpack there.
Do you think we have enough guidance right now on travel?
No, we don't, because we don't really know what one dose can do. We don't really know how Delta is behaving in various countries. We don't really know yet the extent to which vaccines offer long-term protection and whether or not mask mandates should be maintained yet. So a lot of unknowns. As a result, governments are slow and reticent to offer guidance, and I totally understand that. For some people who have to travel, we do know enough. We know that 2 doses, wear a mask, keep your distance, watch your symptoms, and you're probably okay.
Right. Well, the fully vaccinated Canadians can now skip the Hotel Corona when they come home in the 14-day quarantine. And so the question becomes, are more people going to be traveling? It sounds like from the conversation that Patricia Bowl had with the head of the Ottawa airport, they already are.
Yeah, I think they will travel. Absolutely. It's probably a good thing to drop the quarantine for incoming Canadians with 2 doses, with the caveat that maybe you need to have a negative swab test or watch for symptoms at the very least, because the quarantine hotels weren't working that well and may have been the source of some infections, not due to a failure of the plan, but a failure of enacting the plan. So that will free up some resources, I think. Vaccination has to mean something. In this case, it means skipping quarantine hotels.
In the UK, they're dropping their mask regulations as of July the 19th. No limits on how many people you can hang out with. You can gather socially wherever you want. And they're not even going to tell people anymore that they should work from home. Mask restrictions have also been lifted in Alberta as of Canada Day, July 1st last week. What do you think of that approach?
I don't think it's a good idea. And here's why. Delta is real, and Delta is a little scary. And we know that Delta is raging through the unvaccinated populations of Europe and having some penetration into the single vax and even some into the doubly vax population. So the threat has not gone yet. We don't know yet the extent of vaccination's ability to prevent infection and suffering. In Israel, for example, Pfizer is showing to have a lesser efficacy against Delta than we thought, with some vaccinated people getting sick. So while we're figuring things out, it makes sense to keep in place the one simple, inexpensive, easy-to-use tool that we have, which is masks. So this desire to doff the mask quickly strikes me as more of an ideological, emotional one than it is based on science.
There was this preprint study, and I want to stress that it was preprint, but it was published on Saturday, showing that 1 dose of Pfizer, Moderna, or AstraZeneca, that it actually did have some effectiveness in preventing the Delta variant. So I'm just looking here. It found that all of the vaccines approved for use in Canada are doing better than first expected at preventing symptomatic infection, hospitalization, or death from the coronavirus variants of concern, even just after 1 dose. What's your sense of that?
If it's true, that's fantastic. That puts us in a much better position because we have close to 70% with 1 dose at least. But that's contraindicated or contradicted rather by the data out of Israel, which says kind of the opposite. Mm-hmm. So I don't know what to believe yet, except that we know that 1 dose offers some protection, which is great, and 2 doses offers even better protection, which is even better. So get more doses to more people. That's the answer here. Now, with the UK opening things up, it's a little early, I think, again, because the number of people with 2 doses is just so small. Number of people with 1 dose is less than us, proportionally.
Yeah, and I should say, for the Delta variant of concern, the study's authors had to rely on a much smaller and less reliable sample size because they're only able to confirm those cases through genomic sequencing, which is expensive and I guess quite laborious to apply to all of the positive cases. So that should be kind of underlined, just flagging that preprint study. Plus, the other thing, Raywat Deonandan, is that there are studies coming out all the time. Doesn't necessarily mean you're getting the full picture.
That's exactly right. That's the nature of science here. We have to combine all the studies into a meta-analysis and only select the best quality ones. And the data is going to vary depending upon when you do it, the population you do it against, et cetera, et cetera, et cetera. But the bottom line is we know that vaccination works. We know that vaccination has at least some ability, if not really good ability, to stop the flow of Delta. And we know that it's not perfect. That means 2 things. One is the path forward is clear. 2 doses for everybody. The second thing it means is the path forward is clear, but it must be joined safely and slowly, which means don't throw open the doors all at once. Bit by bit, lift the mitigation tools so that magically, late in fall, suddenly we have something resembling normal and nobody's dead.
Raywat Deonandan, thanks so much for coming on the show. Appreciate it.
Thank you.
Raywat Deonandan, Professor of Epidemiology and Science Communicator at